Benign Prostatic Hyperplasia, BPH, is a common condition that affects men as they age. It occurs when the prostate gland, which is located below the bladder and surrounds the urethra, the tube that carries urine from the bladder out of the body, enlarges. As the prostate gland grows larger, it can put pressure on the urethra, leading to a variety of urinary symptoms like increased frequency and urgency to go at all hours of the night. Prostatic artery embolization, also called PAE, is a minimally invasive procedure done by one of UCA's interventional radiologists through a small catheter inserted into an artery in your groin. The interventional radiologist will then guide a catheter into the vessels that supplies blood to the prostate. Tiny, round microsphere particles are injected through the catheter and into the vessels that feed into your prostate to reduce its blood supply. Following this procedure, the prostate will begin to shrink, relieving and improving the symptoms within days of the procedure. Now that the prostate begins to shrink to its normal size, there is less pressure on your urethra, allowing you to void your bladder easier and less frequently.
My name is Robert Edelstein, and my PAE was done a little over 2 years ago. I had the procedure, which, by the way, was absolutely painless. It was just not necessarily, I don't want to have it every week, but it was just a lot better in every aspect. They asked me to, after the procedure, just to sit, to relax, and in about an hour to see if, in fact, that I could void. I went to the bathroom after about an hour, and lo and behold, I was able to void. You know, it wasn't a steady stream kind of thing, but it was markedly better than what I'd had when I was in the hospital, you know, trying to go through all those tests. Like I'd mentioned, I had no sexual performance problems whatsoever, and as an aside, I also recommended 3 friends of mine who had the exact opposite problem, where they urinated often, and they again expressed their gratitude because it worked extremely well for them also. And as far as what happened going forward after the procedure, went home, and each day the flow became better and better. I've had absolutely no problems after the last 2 years, and when you're able to urinate better each day, that in itself is it's a wonderful outcome.